Okay, this program that I developed is about lung training. Now it's about breathing properly. A lot of people have stress breathing, or they don't take deep breaths, and we don't focus on breathing because it's autonomic. It happens without us thinking about it. But we're going to talk about different ways that we can look at breathing and improving our lung capacity. So there's many benefits to that in terms of lowering your resting heart rate. The more oxygen your body has, the less speed your heart has to beat at. So there's a lot of benefits to lung training and improving your breathing patterns. And we'll talk about that today. And let's get started. So again, active members for credits toward LMHF Wellness Program Part 2, you must watch the video in its entirety and comment on each video with your name. Once confirmed by LMHF, your comments and name will promptly be removed. Okay, so let's talk about lung function. So obviously, the most important thing outside of food, water, shelter is oxygen, right? So our lungs are the way our bodies take in oxygen. We take in air, we remove the oxygen, we expel carbon dioxide. So the main thing is we're taking in oxygen, and I'll go through the whole process of how this all works. But basically, the deeper we breathe, the more oxygen we have in our body, and the less stress we have in our heart. Our heart is constantly beating until we go through cardiac arrest and no longer exist. But we want to take stress off the heart as much as we can. So the more beats we can reduce that stress off the heart, the better off our heart is, the less work it has to do. So our respiratory system is autonomic, meaning that we breathe without thinking about it, right? But we can also take over that control and focus on perfecting our breathing or being mindful of our breathing. So for the most part, when we look at breathing, people just kind of, you're going to breathe regardless. If you're exercising, you're going to breathe heavier, it automatically happens. Yes, but there are other factors which are going to affect it. Aside from any COPD, asthma, breathing disorders, there's a lot of things that go into the ability for us to breathe properly. A big thing would be if you have a lot of visceral fat in your abdomen, in your stomach, your diaphragm can't pull down very far, so you're not getting a lot of air into your lungs. Most people that take a deep breath, they're going to breathe like this, so they're going to shrug their shoulders up to increase. So you're only really getting air into the top third of your lungs. You're not drawing it down into your lungs, the lower 2/3. So what we want to do is we want to give our bodies as much time and space to absorb as much oxygen as it can, and then expel as much CO2 as we can. Okay, so there's a lot of factors that go into this, but again, your autonomic nervous system is on autopilot. We breathe. When we're sleeping, we're breathing. Obviously, there's issues with sleep disorders and people stopping breathing, which is a big thing these days with CPAP machines. But there's a lot of factors that we need to look at to make sure we're breathing properly. Because again, it's number one essential to staying healthy and alive. So we can take over control, like I said, of our nervous system. We can switch over and focus on how we breathe. It's not really a permanent change. It's just kind of a good way to reduce stress and relax. So stress breathing is very common, meaning that a lot of people have a lot of tension in their traps and their shoulders because they're using these muscles to breathe. So when they breathe in, they're actually shrugging their shoulders up, which is not the proper way to breathe. If you're to see an infant or a child sleeping, their stomach is going up and down. It's not their chest rising and falling. Their rib cage pretty much stays in place. It's their stomach up and down. And what happens there is that when your diaphragm pulls down, it actually reduces the pressure in your lungs and it pulls everything down into your lungs deep. And then as you exhale, it's pushing that diaphragm back up. So just like in this diagram at the bottom there, it's not labeled, but it's below bronchial right there. That little kind of curve there at the bottom, that's your diaphragm. So when that pulls down, that's reducing the pressure and it's pulling the air in. The further that pulls down, the deeper you get that air down into your lungs. And as you exhale, the more that forces it out. So you're getting a higher ejection of those waste products or byproducts. So when we look at meditation and whatnot, with mindfulness, the number one thing they look at is your breath, right? Focusing on your breathing. Take control over that. It is autonomic, but you do have the ability to take control over it. So that's a huge, huge component of mindfulness and meditation. Now, if you look at the cardiovascular system, cardio is heart, vascular is going to be blood vessels. So obviously our lungs bring in the oxygen and then it's transported around the body through our vascular system, and our heart is our pumping mechanism. Things on the left side, which are blue, are going to be deoxygenated blood, so there's less oxygen in that. There is some, and then the red is rich in oxygen. So the main thing is our body is transferring back and forth. It's using what it needs, pass the rest on. Oxygen in, carbon dioxide out. Back and forth, feeding our cells based on our requirement of oxygen. So if you're exercising, that's going to increase. Your cells need more aerobic energy, so they're going to need to use more oxygen for endurance type things. So this is our transport system of transporting oxygen and CO2 around. So the waste products are expelled as you exhale. Obviously, we're looking at CO2, so your body is using oxygen and passing off carbon. And we'll talk about some interesting stuff in terms of water vapor and carbon dioxide that you're exhaling and the relationship between that, your metabolism, and body fat. So again, looking at your lungs, heart, blood vessels, that system together. All right, so your blood is basically red blood cells, which actually are sticky and they hold the oxygen to them and transport them around to the cells. Our white blood cells are our immune system. Our platelets are going to be there to repair any damage to the lining of our blood vessels and also clot if we get cut or something like that. And then obviously we have plasma, which is just the fluid of our blood. I talked previously about hydration, things like that, and with exercise we need more fluid, which will replenish those plasma levels and making sure you're not dehydrated and your blood is not really thick. So it should be flowing as long as you're properly hydrated. So red blood cells are created in our bone marrow. Our hemoglobin levels are something to look at testing. If you have low iron, things like that, your red blood cells are less sticky, so they don't carry as much oxygen. There are obviously some issues with sickle cell anemia and change shapes of our red blood cells, which can affect oxygen, flow and whatnot. But really getting your iron levels tested is important. I would suggest, eating as much iron-rich food as you can. Obviously meat and liver and things like that, but also dark leafy greens also have a lot of iron in them. So the healthier route is that. You can also, obviously, your doctor might recommend iron supplements and things like that to increase your iron uptake. But basically, again, you're transporting oxygen around your body with your lungs. As long as they're working properly and you're getting as much oxygen in as you can and then expelling the CO2. So a couple other things that your blood does, it obviously forms blood clots, carries cells and antibodies that fight infection around your body as a transport system. Transport waste products to the kidneys, liver, which filter out, clean the blood, and regulate your body temperature. Now, the one thing that we want to look at are your oxygen levels. So I brought this pulse oximeter, similar to the one that's in the picture. And you can buy these really inexpensively. Obviously, hospitals and ambulances and doctors' offices all carry these. And they're really simple. And the two things that they're going to do is it's going to tell your oxygen saturation level, and typically it's going to show your heart rate. Okay? So what we want to look at with these is the level of oxygen that's circulating in your bloodstream. There's actually this little red light inside here. Just clip it on your finger, and it's going to give you a reading of your oxygen saturation level and also your resting heart rate. So you can kind of see it here. So my oxygen saturation is 98, and since I'm standing up talking and moving around, I'm about the 90s in terms of my heart rate right now. So these are really important, especially if you have COPD, emphysema, sickle cell anemia, asthma. These things are pretty handy just to kind of test where you're at. But for the most part, this is just an assessment tool, and then the process of increasing that or correcting that is going to take more work and time. but it's a great way to show how well your lungs are working, how is your body exchanging oxygen and carbon dioxide, and is it working effectively? So your respiration rate, which is going to be your breaths per minute, on average for most people, most adults, is 12 to 16 per minute. Now if you're exercising, doing something much more active, that's going to be way up. But for the average person sitting or doing a basic thing, it's going to be 12 to 16 breaths per minute. Now, for the most part, when we look at if you are doing something, let's say you're climbing a set of stairs or several sets of stairs, several flights of stairs, you're going to transfer from being able to breathe through your nose, having to breathe through your mouth, and you're kind of huffing and sucking in as much as you can. And that's natural. Your body's going to naturally shift to that. You don't have to think, well, now I got to breathe through my mouth. Your body is automatically going to switch to that. It identifies that you need more air in your lungs to suck out more oxygen, and it's naturally just going to increase the amount coming in. So that's going to increase by not having to go up through your nose, but go right down through your mouth. So that's going to increase the amount of oxygen volume-wise that's coming into your body, and by blowing it out your mouth, it's going to exhale more of those waste products. So the main thing is when you're transitioning from activity to exercise, let's say you're doing a walk and then you switch to a jog or something like a sprint, you're going to have to start huffing and getting in more air because of that increase in your intensity. So that's just something your body's naturally going to do. You don't have to think about it, it's just going to happen. So again, it's autonomic, it automatically happens. You don't have to think about, now I have to breathe through my mouth. It's going to transition to it itself. So increased activity, it's also going to create an increased respiration rate and also perspiration rate. You're going to sweat more, right? So you start moving your body more, those muscles heat up, you dissipate that, so you're actually starting to sweat and get rid of some of that heat. Okay, so we talked a bit about stress breathing. So if you ask someone to take a deep breath in and they raise up their shoulders and their chest without drawing their diaphragm down, that's stress breathing. It can create a lot of tension in your upper neck, shoulders, and back, because those are what are considered accessory muscles of respiration, meaning that they can help, but they're not really the main, they shouldn't be working all the time. And that's what sometimes happens in our body with imbalances, is a muscle will work to do an action, even if it's not what it's supposed to do, just to kind of help out. But unfortunately, what we do a lot of times with this stress breathing is we're not using our diaphragm, we're having to use these other muscles to do the same work. Now, hyperventilation or a panic attack is kind of like a form of stress breathing, to where you're trying to get the waste products out, but also get air in, so you kind of get this jamming type motion. And you're not getting full breaths in, full breaths out. Sometimes you see this jokingly with like a brown paper bag, people breathing in and out. And that's just kind of a way to focus on something to get those deep breaths in or out, right? So if you're under a lot of stress, sometimes people say, just go take a walk. And what are you doing when you're taking a walk? Your body's increasing your respiration rate. You're focusing on getting that stress or waste products out of your lungs. So it does work. Belly breathing is what we look at. Sometimes they call it yogic breathing. Pilates breath is a little bit different. Pilates is more through the sides of your rib cage, which is a bit different. But belly breathing or yogic breathing is breathing through your diaphragm. So as you inhale, your navel comes out. As you exhale, your navel comes in. Your chest does not move. So those are keys when we're looking at proper breathing and taking stress off your heart. It's going to happen when you're breathing the proper way, like an infant would. Now, a couple things you want to look at is you want to increase your lung capacity over time. Now, obviously, if you're smoking or have asthma or around things that are pollutants in the air, it's going to kind of clog your lungs a bit, and it's going to be tougher to breathe, and your heart rate's going to be, and blood pressure will be higher than they should be. But you want to focus on training that system and training it so it's built up, so you're avoiding a lot of these problems. And some of it's postural, some of it's breathing in through your nose, not through your mouth. Inhale through your nose, exhale through your mouth. There's some things that I'm going to talk about on ways to really train this. But you want to conditioning lowers your resting and exercise heart rate. So when we talk about like HIIT conditioning, high intensity interval training, ups and downs, that's increase the amount of air you can take in, your tidal volume, over time through that conditioning process of exercise. So the exercise effects, again, using like HIIT and things like that, is your oxygen requirements are increasing as you're doing that. You're going from aerobic to anaerobic type training. So you're doing kind of resistance and cardio at the same time, which is considered the best way, I would say, based on my experience, is doing both at the same time versus doing, cardio first, then weights, or weights and cardio, just combine them together. A lot less time, but a lot more bang for your buck. So when we're exercising, our oxygen requirements increase. Like I said, if we're going upstairs or doing something real strenuous, we have to switch to breathing through our mouth, which automatically happens. Your heart rate increases, your respiration rate increases, and perspiration rate increases. Everything goes up, it ramps up based on the activity and intensity of what we're doing. So a couple things you can look at in terms of lung training. Now, certain athletes will try to train at high altitudes, which there's less oxygen there, so it makes their lungs work harder, so that when they compete at, let's say, a lower altitude, their body is trying to perform at this high level. And that's one way, like cyclists and certain people that are trying to do Olympic events will train at high altitude. So there's other devices which they've come up with, a couple pictures here, which are these training masks or these little mouth breathing devices, which kind of focus on making our bodies have to work harder to get that air in, and then hard to get it out as well. So some of them work by resisting in and resisting out, and you can modify those based on the pieces or the adjustment on them. And I've used some of them, they're pretty interesting. If you have any, if you're a shallow breather, it would feel like you're suffocating, so I wouldn't recommend them to someone that's just starting off. But if you're looking to increase that training, these are some devices, and there's no brands or types that I really recommend. That actually, though, could work if you're into athletic events or you're trying to, let's say, train for hiking or something like that. These are some devices you can use without having to travel to a high altitude. Now, your heart rate is based on, obviously, like we said, oxygen requirement. So that's measured in beats per minute, and your resting heart rate, the true way to test your resting heart rate is before you get out of bed, test your resting heart rate 3 days in a row. So while you're still in bed, either use your wrist, your neck. There's lots of free apps on your phone with a light. There's chest straps, there's Fitbits, there's all different types of devices. But to really find out where your true resting heart rate is, you need to take the average of 3 days in a row. And that's roughly where it's at. Now that number, as you're aging, as you're exercising, as things change, is going to change over time. But a key to taking the stress off your heart is to lower your resting heart rate. Now, for the average person, something in the 60s is very good. If you're an athlete, some athletes have ridiculously low resting heart rates in the 40s or 50s. If you're 80, 90 or above, that's a lot of stress on your heart. So those are things you want to address by doing lung training and different techniques we'll talk about to really take the stress off your heart so your lungs can work more properly. So this is where we get to posture. So if you have poor posture, if you're kind of rounded like this, which is called upper cross syndrome, it's putting a lot of pressure on your diaphragm. So with that compression, you're not allowing the diaphragm to pull down and pull as much air in as possible. It's kind of constricting that. So you're only using a very small percentage of your lungs to get air in. If you're standing more upright, that's allowing the diaphragm to pull down so you can actually get more air in to get more oxygen out. Same thing with sitting. If you're sitting in a hunched posture, you're compressing the diaphragm so you can't get that air in. So it's increased. So you could be sitting at your desk and having a resting heart rate that's higher than it should be because you're constricting that space. So again, visceral fat does reduce that space if you're storing a lot of body fat in your midsection. That's where your diaphragm's pulling down too. If it's butting up against visceral fat, you're going to have a hard time getting air in. You get less air in, and your heart rate's going to be much higher, resting and while you're exercising. So if you don't have a good lung capacity and you have visceral fat and you're trying to climb stairs, you're going to be severely winded, and that's going to jack up your heart rate and put your heart at risk for cardiac arrest. So those are things you got to really be aware of when it comes to your posture and how it affects your breathing, which is going to affect your heart and circulation vascular system. So this is what we're looking at here. This is something I teach a lot of people. Usually we do this laying down, but you put one hand over your chest and one over your navel. Okay, so the test is, while you're laying on your back, so you don't have to worry about balancing and whatnot, is you want to inhale and only have your stomach go out. So you inhale through your nose and exhale through your mouth. So my hand that's over my chest is there to make sure that I'm not trying to expand my rib cage. Just my navel is moving up and down. Now if you're prone on the floor on your back, you can really sense this and feel this. So the key is you don't want to allow your chest to move up. It's all got to be through your stomach going up and down. Inhale through the nose, stomach goes up. Exhale through the mouth hard, stomach pulls in. And as you pull in, your abs contract, your core contracts to force that air out. You've relaxed the core to allow pressure to decrease and pull air into your lungs. You exhale, force it out your mouth, and contract your abs and core to force that out. So it's almost like a core training exercise. So again, on the other side, the wrong is chest breathing. So if you go to take a deep breath in, like that, you see I'm only getting like the top third. It's a very short breath and not drawing the air down. Very important, especially when you're doing mindfulness or meditation, is you're trying to draw that air as deep as you can into your lungs. You're focusing and taking control over your breathing onto yourself. So again, inhaling through the nose, your belly goes out, you see the diaphragm pulling down. Exhale, you force your stomach in and it forces the air out, and you exhale through your mouth. Okay, now this is something I mentioned earlier. A lot of people have been questioning about this, and there's a really interesting TED Talk about this. When you lose body fat, okay, when you burn calories and you're losing weight in terms of body fat, where does it go? And some people have thought that it was just a spark, it's just energy, and it's just gone. Well, nothing really disappears. Everything is turning into something, right? So matter can neither be created nor destroyed. So what's happening is, when you're burning off body fat, what's actually happening is you're exhaling it. Okay, you're exhaling body fat, which is carbon, hydrogen, oxygen, CHO, and you're exhaling it as carbon dioxide and water vapor. So if you ever have had a metabolism test done, they're going to put a mask on you and they're going to test to see what you're exhaling. They're going to test those levels to determine what you're metabolizing, your metabolism. So typically they're going to look at your basal metabolic rate, which is at rest, and then as you exercise, your basal metabolic rate plus activity factor kind of would dictate your metabolism. So in essence, we can track how much body fat we're burning based on what we're exhaling. Now you cannot hyperventilate and burn more calories. It doesn't work that way. It's just that's the way your body expels body fat. So carbon, hydrogen, oxygen, which are what carbohydrates are made out of, are just energy. When you take that energy and you use it, and you use that spark, you got to get rid of it. So you get rid of it by releasing carbon dioxide and water vapor. So that's how this all works, and that's a connection between the two, which is very interesting because that's how our bodies work. So take the time to be mindful of your breathing. Try that test. Put one hand on the chest, one on the stomach, and see if you can do that. If you can't do that, some of those other factors would apply. And the factors, again, would be visceral body fat, which you would have to address through nutrition and exercise, making some changes. Postural things are going to affect your breathing, so trying to be more upright, especially if you're standing or sitting, and just find ways to improve this stuff and measure them by your resting heart rate. You can use it by your hand, you can use an app, you can use a wristwatch or a Fitbit, There are a lot of ways to track this, but it's a process that really does yield a lot of great return because our hearts will benefit from it. So I hope you learned something in this video. If you have any questions, feel free to email me. Have a great day.